Hey guys, Dr. Joe Rangel. Today we're going to have a little bit longer of a video. We're going to be talking about peptides. We're going to be talking about how to reconstitute them, how to properly store them, how to properly handle them, how to properly administer them, and all the gear and stuff you're going to need to get all that done. But first, what are peptides? Well, so things happen in the fitness industry in waves, right? Bodybuilders and athletes have known about peptides and peptide chains for a very long time, but now more lay people are starting to become aware of them, and I think that's great. So let's explain what they are for the absolute noob. Okay, so a peptide is an amino acid chain held together by something called a peptide bond. Some of these things can be found naturally occurring in your body, and some of these things are lab created. Peptides do certain things when they're introduced into your body, and all of them are a little bit different, so there's no need to get into like exactly how they work. And there are literally hundreds and hundreds of these things, okay? Some of the more popular ones you might have heard of are the GLP-1s, or the most current one being tested is the GLP-3 retatrutide, right? And these are being used for weight loss, insulin control, diabetes, those kind of things. There's other very popular ones like MOTS-C. BPC 157 is used frequently to assist in healing and those kind of things. So there's a ton of them, and there's a ton of different things that they potentially do for you to help you with your fitness and health goals. That being said, it's important for you to understand that just like all things in fitness and in health, it really comes down to your lifestyle choices, your diet, your training, and those things you're doing, right? There is no magic drug. There is no magic pill that you're going to take. So if your diet is shit, right, MOTS-C, the peptide, isn't going to help you lose a bunch of fat. That's just not going to work out for you that way, okay? So that's one thing. The other thing is, nothing I'm saying here today is meant to be medical advice. We're not trying to diagnose, treat, or prevent any kind of illness. All right. Make sure you understand the laws in your area, both federal, state, and local, regarding ownership, sale, and use of things like peptides. I don't want anybody out there breaking the law. And always please consult your physician before you use or introduce anything into your body or your fitness program. All right. So with that said, let's get into it. Okay. So first things first, the shopping list. The first thing you're going to need, and this is not negotiable in any way, shape, or form, is alcohol prep pads. All right. So these are your standard alcohol wipes that you've maybe seen at the physician's office. You can buy these in any drugstore. They're not a controlled item at all. You're going to need these, one, to clean all of the vials that you're going to be using, and two, to clean any site that you plan on injecting the peptide into. This is not negotiable. And what we find is people who have been doing this kind of stuff for a long time, sometimes maybe they get a little bit lazy about hygiene. That is a great way to introduce bacteria both into the vial or into your body, cause sepsis, and potentially hurt yourself very bad and or kill yourself. So please don't mess around when it comes to hygiene, all right? You're going to need the alcohol prep pads. I know some people that wear rubber gloves. I always wash my hands before I do any of this stuff. So hygiene's no joke. So alcohol prep pads, absolute must. The second thing you're going to need is a vial of bacteriostatic water. This is not sterile water. This is not distilled water. This is not drinking water from the store. This is bacteriostatic water. Bacterial meaning bacteria, static meaning no motion, or in this case, no life. This water has been specially treated to make sure there are zero bacteria in this water. And you'll see that it has a little injection port on the top. This is pretty cheap. You can get a bottle of this stuff, 30 milliliters, for about $19.99 online, anywhere. Again, not a controlled substance, so easy to come across. This is going to be important. You are going to need insulin syringes to 100 units, or 1 milliliter insulin syringes. There are several different types of syringes out there on the market. Some are meant for intramuscular use, that's IM use. Some are meant for intravenous, that's into the vein, and some are meant for subcutaneous. The intravenous and subcutaneous, they kind of go back and forth. That's what you want here, an insulin syringe for subcutaneous use, okay? We don't want the big intramuscular boys, right? That will wreck your day, I promise. All right, so you're gonna need some of these. And again, check your local laws before purchasing those. I know in California, for a long time, you needed a prescription to get those from a doctor, and then in other states, you can just buy them. And of course, you're going to need your actual peptide. Right? When your doctor gives it to you and you pick it up from the pharmacy, or if you're allowed to just purchase these wherever you're at and you purchase it, you're probably going to get it in a vial like this, which, as you can see, is a little glass vial. It has the injection port on the top, but it's a white powder in there. Okay? That's important. And the last thing, and this is completely optional, but it's something I like to use, is a insulin syringe with a lure lock on top. And you can see the difference between this and the other syringe. The one with the lure lock has this little screw top on top. And the reason why that is important is because I can use different needle heads, screw it on, do what I need to do with it, screw it off, and put on a different needle head for the actual injection. Okay? And the reason why you want to do that is because to draw the peptide out of the bottle once you've reconstituted it can be a real pain through the tiny little syringe that you're going to be using. It can take forever, right? So if you get a larger, more intramuscular style needle, screw it on top, draw it out very easily, unscrew that, then put on your tiny little subcutaneous syringe, and then it's no muss, no fuss, and no pain. Okay. Again, optional, not necessary. But it's something I like to do because, well, I'm a wuss and I don't like pain. So that's the shopping list. There's other stuff you can get. There's stuff out there people like to use. All of that is optional. The stuff here, with the exception of the lure lock syringe, absolute must. Okay. All right. Next, storing your peptides. There's some stuff out there that says that a peptide is only good for 28 days post-reconstitution. So once you've mixed it and made it into an injectable liquid, it's only good for 28 days. That is not exactly true. Research was conducted on peptides to determine how long they could last before bacteria was getting introduced into the bottle. And why would bacteria be getting introduced in the bottle? Well, because you're going to be using this for more than one draw, right? So every time you take a needle and stick it in the bottle and pull something out, you're running the risk of bacteria coming in. And you're also creating a little hole in the top, which runs the risk for bacteria coming in. And what they figured out was 28 days was just about the limit of time that a peptide can be used and reused before we start worrying about infection in the bottle. Now, do peptides have a shelf life? Yes, they do. Some are actually much less than 28 days. Some are actually a little bit longer than 28 days, but everything is right around that 28 days. So as a catch-all for everything, for both safety and peptide utility, we say 28 days. If you're curious about your particular peptide and how long it's actually good for, you can always do that research. But 28 days, that's about it. Bottom line, once you reconstitute it, you want to start using it, and you don't want to hold off on using it. And if you leave it in your fridge for weeks and weeks, it's probably no good anymore. All right. Peptide handling. This white powder is incredibly fragile. You don't want to drop it. You don't want to shake it. You don't want to mix it all up, right? And it's even more fragile once we reconstitute it into the liquid. Once this thing becomes a liquid peptide ready for injection, it is incredibly fragile and incredibly heat sensitive, which means it must be stored in the refrigerator. And I've seen stuff online, the bro science people out there saying, I left mine on the counter and it works just fine. Okay, don't do that. One, you leave it on the counter at room temperature, you're running the increased risk of bacterial infection. And two, some of these peptides will literally start to degrade if they're not kept in a refrigerated state. The refrigerated state, not so much necessary for the powder version, but once it's liquefied, yeah, absolutely. It's got to stay in the fridge, okay? As to the fragility of it, when you're injecting the water into the peptide to reconstitute it, you're going to be tempted to try and dissolve the white powder up to shake it. That will destroy it. To swirl it around, that will destroy it. To roll it back and forth in your hands, you guessed it, that will destroy it, okay? These are incredibly fragile amino acid chains. When you're injecting the bacteriostatic water in here to make it into a usable peptide, you're actually just going to let it drip slowly, right? Sometimes I'll even turn this thing upside down, put the needle in the bottom, and let the water kind of bubble out of the top of the needle and slowly fill the vial up, all right? This is not a fast process. Reconstituting peptides takes a while. So if you're up in the morning in a rush and you've got to get out the door, that's not the right time to do it, because one of two things is going to happen. You're either going to be late to where you're going, or you're going to inject too fast and you're going to destroy this peptide just from the force of the water hitting it. All right. So we have to be gentle with the peptide. We have to be very, very careful with it, and we have to keep it refrigerated. 28 days is about the limit. All right. Good. Next, actually reconstituting the peptide. So the first thing we're going to do is we're going to take our peptide, expose the injection port on the top, and I've already washed and cleaned my hands. And we are going to get one of our antimicrobial wipes, our injection wipes. We're going to clean the top of that injection vial. Some will say, oh, well, it had a lid on it. It should be pretty, just clean the dang thing, okay? You're going to get your bacteriostatic water, and you're going to clean the top of that too. Everything is going to be clean. And put that off to the side. Reconstituting the peptide. We've got our insulin syringe. Be careful, it's pointy. So you might be tempted to just stick this thing in the vial and then try and draw. What you're going to find out is all of this stuff is vacuum sealed, so it's air neutral, right? So if you try and draw out of a vacuum, you're going to find that very, very difficult. So what I like to do is, I know how much I'm going to pull. I fill the syringe up with that much air. So in this case, I'm going to pull a full milliliter, so 100 units. I fill the syringe up with 100 units of air. And I will actually inject that 100 units into the vial before I try and draw it. And now I'm going to draw my 100 units of bacteriostatic water into this syringe. While I'm waiting for this to fill, you may be wondering, well, Joe, how much bacteriostatic water do I use for the dose that I'm going to be giving myself? That, my friend, is entirely dependent on your physician and what you have determined the proper dose for you is. You can go online and find a peptide dosage calculator apps. I use one frequently. So you know how many micrograms or how many milligrams or how many units of a particular peptide you're getting per every milliliter of water you're putting in. It's not the same for everything, and it can be a little bit complicated, especially when you're dealing with 1 milliliter of water versus 3 units of peptide that comes in a 5 milligram bottle of peptide. It can get very confusing. So a good peptide calculator is your friend. All right, I have my 1 milliliter of bacteriostatic water in my syringe. And now I have my physician-prescribed peptide here. And I'm going to inject that slowly. And what you're going to see is the plunger is going to go down on its own because of the vacuum seal. And actually get the thing in there. There we go. You see the plunger sinking on its own. Okay, that's the vacuum seal. There's no need for me to push on it. Just let it do it itself. You see I'm holding it out of side to kind of limit the amount of direct hit it's getting. And we're going to pull it out. And you can see this is not fully dissolved. It's just sitting there. Next thing. I like to reconstitute with 2 milliliters of water. Some peptides will actually use 3 milliliters of water, although that can make it very, very, very full in that little bottle. And some will only use 1. Again, it comes down to your particular peptide, the dosage your physician has prescribed for you, and what your goals are. So this one, when I put it back in, you're going to see that we have a limited amount of pressure now, and it's actually moving incredibly slowly. Right? And there we go. 2 milliliters of water. First things first, if you don't have a sharps container to dispose of this stuff in, you must be hygienic and safe about the way you dispose of your needles. Okay, don't just leave these laying around for people to find. That's gross and it's disgusting. Just because you're not doing something illegal with it doesn't mean that you can be nasty with it. Okay, so I have a sharps container I like to dispose of stuff in. A lot of people will use empty protein jars and throw them all in there and then tape the jar up, whatever. But you got to be safe. Be mindful of other people, right? People are gonna have to throw out your trash and stuff. They don't want to deal with this stuff. Okay. There's messages out there that say never recap the needle. There's messages out there that say do recap the needle. If I'm using my sharps container, I don't recap, I put it in. But because I'm going to be making this video right here for you, I don't want an exposed needle sitting out on this counter while I'm talking to you. So I am going to recap this needle, which is sort of dangerous and not a recommended thing to do. So just use your sharps container, okay? But that's going to sit right there. All right, so I've now reconstituted my peptide. It's still not completely dissolved. What do? Do I shake it? No, we know that. Do I roll it around? No, I don't. I can do this gently, very gently. All right, but really I'm just going to let this sit. And it's going to have to sit there for a while, sometimes an hour, sometimes less for it to reconstitute. Okay. What am I going to do once it's done being reconstituted? If I'm not going to use it right away, where does it go? In the fridge, right? And that's where it lives for how long? 28 days. How to use and how to inject your peptide. You may notice that when I was reconstituting the peptide, I used the same needle over and over and over again. You can switch out needles, whatever. The point of switching out needles is for hygiene, all right? Because I'm drawing and putting it back into the same bottle, back and forth, should I technically use more than one needle? Probably, all right? But this isn't going in my body. It's not going anywhere near my body. It's just going back and forth, and I sanitize the lids on both of those. Obviously, you're never going to inject yourself with the same needle more than once. Obviously, you're never going to share needles, okay? I mean, these are things that I feel like I don't necessarily need to say, but maybe I should say, okay, hygiene is very important. These are one use and done. The thing about these insulin needles and why I don't want to now stick this one in my body that I used for reconstitution is every single time I poke that through the lid, it dulls it up a little bit more. And you're like, oh, well, how bad could it be? I promise you, if I tried to inject this into myself under my skin right now, it would hurt, all right? Every single poke with it hurts, which brings me to the lure lock. So now let's say I'm actually ready to inject my peptide here. So the first thing I'm going to do is I'm going to take my draw needle. This is an 18 gauge draw needle. It's actually a little bit big for that bottle, but it's an 18 gauge draw needle. This is the type of needle they'd use for an intramuscular injection, okay? Do not stick an 18 gauge needle into yourself. I promise you, it's like hammering a nail into your body. You won't like it, all right? I've got my lure lock syringe and I screw it on there. Now, this syringe is not useful for being used in the human body, all right? I've had it sitting out here. It's been sitting on this towel. It's not sterile anymore. It's not useful at all. This is strictly for demonstration purposes only, okay? These things come sealed in individual packages. You don't open the package until you're ready to use it, all right? But like I said, this is for demonstration purposes only. So I've screwed my draw needle onto the 18 gauge syringe. I remove the cap, and I'm going to put this into my peptide and draw out the amount that I want. You can, if you want, do the same technique that we did before and say, let's say I know, okay, I need to pull to the 0.2, pull 0.2 of air, put it in, push 0.2 of air, and that'll make it easier to draw 0.2 of the peptide back out, okay? Very doable. Once that's done, I'm going to recap my draw needle, take it off, and put on my actual administration needle. Now, I want to show you something. You saw the draw needle. There's the administration needle. Okay, tiny little guy. All right. This guy is the one that I'm going to use to do the actual injection into my body. All right. So, where do we put peptides? I mentioned before, there's three, there's three types of injections: intramuscular, intravenous, and subcutaneous. Intramuscular, if you're somebody who knows somebody or you have in the past used anabolic steroids, or perhaps you've gotten certain vaccinations at the doctor's office, it's very likely an intramuscular injection. And intramuscular means literally what it sounds like. They use a larger needle. It goes into a large muscle group, and the medicine is injected into the muscle. Okay? You don't want to do that with the peptides. Intravenous is when you go to the doctor, and usually this is more used in blood draws than anything else. But if you're having an IV or something like that, it's usually intravenous. IV meaning intravenous. So what they'll do is they usually tie you off, right, to make the veins stand out, and then they will take the needle and insert it into a vein. And like I said, this is used a lot for blood draws, but it's also used to introduce medication directly into the bloodstream. Don't do that either, okay? This is subcutaneous. Cutaneous meaning the skin, sub meaning below. So this type of injection goes a lot kind of like somebody with diabetes might inject their insulin. Okay, we are going into the skin, into the fat layer, right underneath the skin, but on top of the muscle. All right. So how do we do that? Well, there's a couple spots that are really good for it. One of those, especially on women, is usually the back of the arm and the tricep area. Another great spot is right off the belly button here on the abdomen. And then some people will also pinch some skin up on their thigh to do it. The thing is, let's say I'm going to use the abdomen part. And again, capped needle, right? It's inert. What we're going to do here is I'm going to get the skin and I'm going to pinch it and pull it off the muscle. Right? If you're somebody who has a larger amount of body fat and you don't have to worry about it, great. But if you're a fairly lean person, you're going to have to pinch it and pull it off the muscle. Then you're going to take your syringe and insert it into the skin, all right? Into the skin, into the fat layer there, all right? I strongly suggest you don't try and go straight in, all right? I like to go in at an angle at the side. Straight in is fine, but to me, this is more painful, and you're more likely to hit something you don't want to hit. So in at the side, right there, little poke, little tiny pinch, inject your medication evenly and slowly, keep a hold of the skin, pull it out, you can let the skin go, and then dispose of your needle properly. If there's any blood or anything comes out, you can use one of these wipes to clean it up a little bit. And you know what? This is a really bad thing. I forgot to say before I did that. Before you do any of that, you need to clean the skin with a wipe. That's a total mess up on my part. So before you inject in the tricep, before you inject in the abdomen, before you inject in the thigh or anywhere else, you have to clean the skin. Okay. Obviously, certain spots like the tricep, they kind of require help because you can see this is kind of a two-handed operation. So if you have somebody that can help you, get behind you, pinch the skin on your tricep, insert and go, then that's great. Don't inject overly fast, and do not inject too much at once. The more you inject, the less likely it's going to absorb quickly. Is it possible to stack peptides in this thing? Well, there's some research out there that says yes. There's some research out there that says no. I'll let you do that research. But here's the deal. If you stack peptides in here, or if you just, for some reason, you're taking something and it requires a really heavy draw, like 9 or 10, but for whatever reason, you've got a lot in there, you don't want to just jam that into your skin all at once really quick, right? This is a very slow, steady, easy thing, because what happens is the liquid needs to get into your skin and it needs to dissipate through the fat cells into your body. If you just put a big ball of liquid in there, it's just going to sit there, right? While it's waiting to dissipate. And so what you end up with is lumps underneath your skin. It can be painful. And even though the peptides themselves aren't necessarily dangerous, when your body detects a foreign object lump mass like that in your body, it can think, oh crap, invader, and start sending out white blood cells and stuff to surround it and start attacking it. And that can just create all sorts of problems, abscesses and stuff. So injection technique is very, very important. All right. A little goes a long way, nice and slow. Make sure the area is clean. All right. With all that said, I think that's all I have for you. If you have any questions, feel free to hit me up. Remember, the most important thing about all of this is hygiene and safety. Make sure you got your doctor's permission to do any of this stuff, and make sure you're obtaining this stuff legally. Don't be breaking the law. Okay? All right, guys. Thanks for watching. I'm Dr. Joe Rangel, the bodybuilding PhD. I wish you all the luck.